Imagine you submitted a perfect medical claim to the insurance company. The CPT codes are correct, the ICD-10 codes are correct, the patient is eligible, the provider is in network, everything is perfect. But the insurance company still denies the claim. But why was it denied? It was denied due to timely filing limit exceeded. Just because the claim was submitted a few days late, the provider may lose hundreds or even thousands of dollars. So let us understand what is the timely filing limit. Timely filing limit or TFL is the maximum amount of time an insurance company allows a provider to submit a claim after the date of service. If the claim is submitted within that time limit, the payer will usually process it. But if the claim is submitted after that deadline, the payer may deny your claim as untimely, even if every other part of the claim is correct. Imagine you're filling out an application for a government job. The last date to submit your application is June 30th. You complete the form perfectly, every document is attached, everything is correct, but you submit it on July 2nd. What happens? Most likely, your application isn't even reviewed. Not because it was wrong, because it was late. Medical claims work in a very similar way. Every insurance company gives healthcare providers a deadline for submitting a claim after a patient receives treatment. That deadline is called the timely filing limit, or simply TFL. If the claim reaches the payer within that allowed time, it can move forward for processing. If it reaches the payer after the deadline, the payer may deny it as untimely, even if the diagnosis, procedure codes, and billing are all correct. That's why timely filing is one of the first things a payer checks when they receive a claim. Missing the deadline can lead to claim denials, lost revenue for the provider, more work for the billing team, appeals that may not be successful. That's why medical billers try to submit claims as quickly as possible after services are provided. Now, let us understand how to calculate timely filing limit or TFL. The answer is actually much simpler than most people think. As an AR caller, I can tell you from experience that there is no difficult formula or mathematics involved. You only need to remember one simple rule. Date of service plus payers allowed filing days equals timely filing deadline. That's it. Now let me explain this with a simple example. Suppose a patient visited the doctor on January 1st, 2026. This date is called the date of service or DOS. Now imagine the insurance company says you have 90 days to submit this claim. So what do? You simply start counting 90 calendar days from the date of service. After those 90 days, the last date to submit the claim is approximately April 1st, 2026. That date is called the timely filing deadline. If the claim reaches the insurance company on or before April 1st, the claim is considered timely filed and the payer can process it. But if the claim reaches the payer after April 1st, the payer may deny the claim for timely filing because it was submitted after the allowed deadline. So always remember this simple formula. Date of service plus payers allowed filing days equals timely filing deadline. Now here's something very important that every beginner should know. Every insurance company has its own timely filing limit. For example, one payer may allow 90 days, another may allow 180 days. Medicare generally allows 365 days for original claim submission. Medicaid and commercial insurance plans may have different limits depending on the state, plan, or provider contract. That's why you should never assume the timely filing limit is the same for every payer. Always verify the payer's policy or provider contract before making a decision. Now, let me share one practical tip that experienced AR callers follow every day. Whenever I receive a timely filing denial, I never assume the payer is correct. The first question I ask myself is, was this claim really submitted late? Because many timely filing denials are issued by mistake. Sometimes the provider submitted the claim on time, but the clearinghouse rejected it, the payer never received it, the claim was sent to the wrong payer, or a system or processing issue delayed the claim. That's why an experienced AR caller always checks the claim submission date, clearinghouse reports, electronic acceptance reports, and any available proof of timely filing before accepting the denial. Now let me show you exactly how to investigate a timely filing denial. When you receive a timely filing denial, don't immediately assume the provider submitted the claim late. Instead, investigate: what was the date of service? When was the claim created? When was it submitted? Was it accepted by the clearinghouse? When did the payer actually receive it? Is there proof of timely filing, such as clearinghouse acceptance report, electronic acknowledgement, certified mail receipt for paper claims? Was the claim rejected and corrected? If so, review whether the correction affected timely filing. Did the payer process it under the correct filing limit? Confirm the payer's current policy. Sometimes the provider submitted the claim on time, but a transmission issue, rejection, or payer processing error caused the denial. If you have proof that the claim was submitted within the payer's timely filing limit, don't accept the denial immediately. Instead, submit a reconsideration or appeal according to the payer's guidelines and attach your proof of timely filing. Your proof may include clearinghouse acceptance reports, electronic claim acknowledgements such as 999, 277CA, or payer acceptance reports if applicable, proof of delivery for paper claims. Any other payer requested evidence showing the claim was submitted on time. If your evidence clearly proves the claim was filed within the allowed filing period, many payers will review the denial and may overturn it. However, always remember that every payer has its own timely filing policies, appeal requirements, and documentation guidelines. So, always follow the specific payer's process. If you do not have proof of timely filing, first verify whether the claim was actually submitted after the payer's deadline. If the claim was truly filed late and there is no proof of timely submission, no payer error, and no contractual or policy exception, then in most cases, the timely filing denial cannot be overturned. Depending on the payer contract and the provider's policy, the remaining balance may need to be written off. That's why experienced AR callers always remember one simple rule. No proof of timely filing means a very limited chance of reversing a timely filing denial.